Hello, friends. Caregivers of persons living with Alzheimer's disease or another dementia are sometimes deemed the invisible patient. How well does the medical care system address the needs of caregivers? Unless the entire family are patients in that practice, or unless the caregiver himself or herself brings up their status as a caregiver, those needs are often in the shadows. Hello, I'm Dr. Renee Harmon. I'm the author of Surfing the Waves of Alzheimer's. It's a memoir about my husband Harvey and his time with younger onset Alzheimer's disease. And because I'm a recently retired family physician, the book and many of my blog posts have an underpinning of my understanding of the medical system. And today's blog post is one of those. So caregivers of persons with any illness are often neglected by the medical care system because the system is focused on the person with the disease, right? But it's so important that caregivers' needs are addressed as well, because the person with the illness is going to be significantly impacted if the caregiver needs are not addressed, and they often neglect their own needs. So one of the privileges I had as a family physician was knowing whole generations of patients. And often when I had a patient who I diagnosed with Alzheimer's disease or another dementia, their family caregiver were also my patients. And it was easy for me to address caregiver stress anytime I saw the patient with dementia or the caregiver for their own appointment. And I did this even if the caregiver was not my personal patient, but probably less often and less intensely when I didn't know them as well as I knew my own patients. But I stressed to all the caregivers that I came in contact with how important it is to care for themselves. You cannot be the caregiver that your loved one deserves you to be if you don't take care of yourself. And I have talked about this multiple times in my blog posts and in my talks, and I'll provide a link to my top 5 blog posts about taking care of yourself as a caregiver. So a team approach to caregiving is another one of the themes that I talk about a lot too. You need a team to help you take care of your loved one. I think a team approach is also needed within the medical care system. Doctors and nurses and pharmacists and counselors and social workers all need to work together to provide best practices to persons living with Alzheimer's disease as well as their caregivers. And too often, the medical care system doesn't communicate with each other. Patients have long complained about that. And we thought that we had hope that electronic medical records were going to solve this communication problem, right? And patients even today think that just because their medical records are stored electronically, that all medical personnel have access to their records, which is just not the case. There are too many different EMRs and they don't communicate with each other. And there's also privacy laws that don't allow, as it should be, the system to talk with each other. So it's still incumbent upon the practitioner to make sure their notes get to other practitioners and other people in the medical care system in a timely manner, so that we're all on the same page. So that's the communication problem. I am excited that there is some research being done now on caregiver stress and how the medical care system can approach caregiver stress. So there are some new apps and websites that are purported to help caregivers navigate. They help streamline appointments. It's a place where you can document medications and symptoms and diagnoses. They also often have a caregiver stress analysis on them that a caregiver can do. But this requires family caregivers to be comfortable with technology, right? So there is research being done on these technologies. How well do these technologies help caregiver stress? There's also research being done with direct contact from the caregiving system to caregivers, medical care system to caregivers. So this usually involves large medical systems such as the VA or large teaching hospitals where these studies are being conducted. A team of social workers will reach out on a regular basis to caregivers, family caregivers, to assess their level of stress. And if significant stress is detected, then they might teach them some home stress reduction management techniques, or if it's very significant stress, they would refer to a counselor for more help. So I'm hopeful that this type of research and maybe new research projects are going to start to bridge this gap between caregivers and the medical system. Thank you. Be well and keep your balance.